You're watching Beyond the Markets, where we bring you up to speed on development outcomes on the continent. I'm Kenneth, Igbomor, and thank you so much for joining me on the show. On today's show, we'll be looking at Africa's response and response strategy to the COVID-19 pandemic. You can join the conversation on social media. Let us know what you think about what we discussed. The hashtag is Beyond the Markets. You can also tweet at me directly at Kenneth Igbomor and let us know what you think. Now, the African Union set up the AU Center for Disease Control COVID-19 Response Committee in a bid to involve the private sector in its effort to tackle the COVID-19 outbreak. Now, chair of the committee, Edem Adzogenu, joins me on the show now to explore what the committee's mandate is going forward. Thank you so much for joining me on the show today, Edem. And I'd like to start with first how this committee came to be in the first place.
Thank you very much. The committee was set up by the AU, which has a task force for resource mobilization against COVID. They realized the need for having the private sector in partnership on this effort. So through the Center of Disease Control of the African Union, they reached out to some of the private sector institutions and members, some of whom were pretty critical and involved in the Ebola resource mobilization campaign, to come together to sort of work with the African Union to work on creating a joint fund, a private sector, public sector fund that everybody can contribute towards, that is under the auspices of the AU, and to also have a governance structure under which this fund will be sort of allocated and dispersed. So the committee has various volunteers. These are pretty much volunteers who are communication experts, IT and innovation experts, people in banking, people in research, all coming together as part of the private sector under this AU umbrella to drive this coordinated campaign, which is extremely essential to sort of absorbing the collective strengths of everything we have on the continent to fight against this scourge.
Looking at the mandate of the committee, so first of all, you mentioned earlier about structuring that emergency fund. I would like to get some up to date on what the level of the funds you've reached so far in raising the funds, the amount raised so far.
Okay, so as you know, different countries have their own funds. They are doing their own responses, COVID responses. But we thought there was a need for a continental response, a coordinated continental response, simply because we couldn't have a situation where under the open market free trade agreement that we have now, we have certain countries open and certain countries closed. So capacity needed to be built for each country on the continent, whether they have the resources or not, because even if they have the resources, it may not even be enough, to get some complementary resources. And by resources, we're also talking about personnel. So we're mobilizing not only fiscal resources and money, but also donations from people bringing test kits, people bringing PPEs, people bringing ventilators, and making sure that they meet the right standards. And this is what the CDC and the AU Fund Board of Governors will be taking a critical look at. Our role and our mandate was basically to help put together the Board of Trustees, bring sure that the governance and accountability process is in place, making sure also that we get private sector champions involved in this process. The AU has a target, AU CDC has a target of about $400 million they want to raise. Like I said, most of this money is going to go into purchasing things they need to send, essential commodities they need to send to the front lines of where the epidemic is going to be peak. So testing is one of the main key things that we want to do to get as many people tested. So far, a number of heads of states have already pledged quite a significant amount. I think about $12 million, $12.5 million. Others are pledging. We've got some private sector pledges also coming in, almost about $2 million of pledges. What we're trying to do now is to finalize the process towards the inauguration of the governance of the Board of Trustees of the fund. The accounts are already in place. And from next week, we'll have the first inaugural meeting of the board, and then also the communication social media campaign encouraging people to contribute towards this fund. And I must stress that it's important to have a fund that has even the ordinary person on the street, the man of straw, contributing to the same account that heads of states and the most powerful business leaders are contributing to. This demonstrates that Africans came together to fight this epidemic in a very unified manner.
All right, then, Edem, we'll get to collaboration in a bit, but I'd first like for you to talk to the importance of that private sector involvement and the route it's taking, because we understand that, yes, beyond the resources as well, the skill, the expertise in dealing with, complex issues can also be a plus.
Indeed, as you can tell, no one was really prepared for this epidemic, not even in the most powerful industrialized global countries. Number two, we're seeing a disruption of global supply chains and trade, which is the lifeblood of every country's livelihood. It's also being very disrupted. We've seen a deceleration of the demand for our commodities, among others. So it requires a number of layers of collaboration. One from the policy angle, from our leaders, and two from just private sector people. I mean, to get to the point where a continent has no capacity to be able to technologically even produce the basic things we need for the survival of our people is a problem. And at a time when other nations need to put the oxygen masks on their faces before they try to help others. And so Africa has no choice but to read within himself, which is why this partnership is important. And the nature of this partnership is really based on people reaching out and saying, I want to help, this is how I want us to support, and coming under the umbrella of the African Union and the CDC to have sort of a collaborative and unified perspective under which we are not only dealing with the health response to this epidemic, but also the trade response. I did mention earlier that the Continental Free Trade area was one of the main focuses of the African Union this year, and trading was supposed to start in July 1. And here we find ourselves in a situation where certain basic things we need from certain countries cannot even move. Food, others. Free movement of people, free movement of goods, all being challenged. So the nature of this partnership is to bring all hands on deck to see how do we work very quickly and expeditiously to ensure that our borders can open again. We minimize harm. We limit deaths, and at the same time we're able to open our borders for people to be able to fly and move around freely and trade amongst us. And look at Africa just as. So it's a holistic.
All right, it's quite interesting that you mentioned the Africa Continental Free Trade Agreement. It's quite interesting you mentioned the Africa Continental Free Trade Agreement, because you've seen the amount of work that has gone in from the African Union over the years to get this running. We've seen a lot of engagements across the continent, from countries, to get everybody to speak the same language, to get all the ducks in a row for this to come to being. But then we're seeing this shock coming here to threaten this fantastic work that has been going into. I'd like to speak on that importance and the experience that you've had in dealing with the collaborations across the countries. What's the feedback you are getting?
So first, as you know, Afro Champions has been representing various institutions and business networks on the continent, the Pan-African Manufacturers Association, the Pharmaceutical Federation, and various business networks, the Club d'Investisseurs, and a lot of patronage or business associations in various countries. And having engaged the African Union, not just from a research standpoint, but also or an advocacy standpoint, but also in helping with the negotiations, the campaign to get the private sector understand how they're going to benefit from the Continental Free Trade Area. As you know, we came together and put together the $1 trillion framework that looked at how Africa was going to be able to drive investment of about $100 billion a year for the next 10 years to be able to build the infrastructure necessary for the continent that didn't use to trade among itself enough to be able to take advantage of its 1.2 billion market and trade among itself. And then along the way comes COVID, and we realized that even our cotton and textile producers who were producing raw markets to feed into other markets. Incidentally, I'm the chair also of the African Cotton and Textiles Federation. and we had to see workers being laid off, going home, and not able to work because whether in Egypt or Kenya or Mauritius or Morocco, the things they will produce to be able to sell to foreign markets are not available anymore. There's no demand for them anymore. And then we're looking at what is happening to our flour industries in Kenya and other places, in South Africa. So there was a need to quickly, whilst dealing with the health as well, put all of this within the context of the CFTA again, because for us as Afro champions, this is even why we need CFTA more, because each country individually will never have the capacity to be able to stand on its own, as we see even in the advanced countries. And there's been a rethink of the global, if you like, trade and investment order. I mean, we're already seeing a reversal of supply chains and rethinking of how the supply chains are going and what are the priorities. One of the priorities we see now are essential commodities, things as basic as sanitizers, masks, face masks, things as basic as gloves, and then you have ventilators and other things. So you need to be able to have companies growing at scale, having to do research and development to be able to produce these essential commodities that the continent needs, and also to be able to have the entire intermediate products that are needed to be able to assemble and manufacture these things. Till this day, we have to import, even for things like protective gears, they are medical grade materials that have to be imported into the country, and we don't have them. And so we've had to even improvise to do some of these things. So my point is that CFTA becomes even more relevant because within the continent are competences, expertise that we can collectively absorb, whether it's in Egypt where they're already assembling some ventilators, or South Africa for that matter. Other parts of the continent have various, Ghana has mapped genomes. So we can now begin to look at how we bring the continent together. Now that the entire globe is reshaping itself towards a post-COVID scenario, not knowing what that world is going to look like, it's important that now that we're challenged, Africa should see itself become geopolitical in negotiating this.
But Edem, very quickly though, what's the level of international support you are seeing?
International support towards the African COVID response has been measured, partly because we haven't finalized the fund and we are not out there marketing. But there's been quite a lot of interest from international companies that are doing business in Africa who have made some initial pledges. Some are throwing support. Others are donating or making propositions to offer us to donate. So there's some international support out there. And as you know, the President of South Africa, AU, appointed also going to be negotiating or even having discussions and deliberations with international multilateral organizations to get support. I think our governments and our finance ministers, trade ministers are also doing similar things. I think what remains now is to bring on board the academicians, the public the private sector institutions, also in the diaspora, become a part of this effort so that we can get more resources, human and essential products into the continent to be able to fight against this epidemic.
All right, Edem, I need to hold that thought for a bit. We're going to a short break, and when we return, definitely we'll continue. I'd like to get a little more into the response strategy going forward. I've been speaking to Edem Adzogenu, who is the chair of the African Union CDC COVID-19 Response Committee. We'll bring you more of the conversation on Beyond Markets after the break. Hello and welcome back to Beyond Markets. If you're just joining us, I have Edem Adzogenu, who is the chair of the African Union CDC COVID-19 Response Committee. He's my guest today on the show, and we've been assessing Africa's response strategy to combat the COVID-19 pandemic. Edem, picking up from where we left off, then I would like you to now talk more about this response strategy, looking at how the committee is engaging to try and combat the COVID-19. I understand that you guys meet 2 times in a week.
Yes, we do, and sometimes if there's a need, we meet 3 times in a week. So the strategy is basically looking at first mobilization of resources, looking at the need to also support the African Union CDC to drive the campaign for testing. We want to test about 1 million people in 1 month in the next 4 weeks, 10 million in the next 3 months. So getting people sensitized about the need to go and get tested, helping with the logistics needed to move these diagnostics and test kits to the places of need, and doing the social communications that removes the stigma away from people who are scared or afraid of going and getting tested, and also working with private sector and government to ensure that we have facilities where people, when they are positive, can be isolated, even in vulnerable communities and local communities. So yes, the first element of this response strategy is getting as many and many people tested. Of course, also making sure that personnel are available where they're needed, and that we're not endangering our healthcare practitioners, and as well as also making sure we're generating the right data and using whatever innovations we have on the continent from all our young tech preneurs who are all coming up with solutions on how we can effectively track, trace, document, and assemble all of these things or aggregate them into the kind of databases that governments can use to be able to make very effective decisions for planning, and also even how we're going to even move our borders. So biosurveillance is also another area that the strategic response is focused around. So mobilization of resources, getting as many people tested, protecting our healthcare workers from harm, and also protecting people from social harm, mitigating loss of lives, limiting deaths, and more importantly, getting data in order to plan effectively.
All right, but in dealing with the health challenge, I would like to understand some of the what you see as the major challenge that you see we can encounter, especially as we prepare even in the medium to longer term.
So a number of challenges come to mind. One is that we are having a scenario where, as much as we're focusing on COVID, we're losing a bit of attention on the other diseases and ailments that are also still plaguing and persecuting us. I mean, Ghana, for example, has seen more deaths from cerebrospinal meningitis in the last 2 weeks than we've seen out of the number of people who have actually died of COVID now. And we have all the non-communicable diseases, the zoonotic diseases, and other things that are still out there. So the challenge remains a public health one, having the capacity for public health institutions to respond in a way that is coordinated with all the other holistic things going on. I mean, one is the economic trade, and to be able to ensure that governments have the right information to be able to make their kind of decisions when to open up countries, should we maintain partial lockdowns, which communities? All of these things are going to require information and data that will, and the science necessary to make those decisions in a way that is expedient and useful for the purposes of providing convenience for people and at the same time saving lives and presenting loss of lives. So that remains the primary challenge. Of course, the economic one also remains a challenge, but of course, from the health perspective, being able to have the right information, getting a lot of people tested, understand the prevalence, but also the infection rates, in order to be able to zone people around in a way that they are not at risk to the vulnerable in society.
All right, but looking at this particular pandemic, though, I'd like to know what the learning curves has been for you, especially from the Ebola outbreak that happened a couple of years ago.
A lot of things to consider. One is that the most important thing is the partnership. Having private sector leaders on a continent who saw the need to work with the public sector during the Ebola epidemic, to mobilize resources, and which that's the precedence we are following now, bringing private sector people, champions, to come together and not just be focused on their country, but also pooling resources for bulk allocations, because trying to look at countries trying to source things on their own, like Sierra Leone or Ghana or Angola trying to source things on their own, when there are bigger demands, when there are huge logistical and procurement challenges from higher demands coming from things being sourced globally. So having CDC and the African Union be able to come together and do bulk allocations and pool allocations for our continent it's a great experience that came out of the support that private sector worked with public for the Ebola epidemic. The other thing is just simply even the lessons that we learned from how the lockdowns took place. Even today in Congo, even though there's Ebola still there, the communities operate under some level of lockdown so that it doesn't spread, even though Ebola doesn't have the same level of high transmission as COVID. Then there's the issue of hygiene. I mean, a lot of airports, as I recall, most of the hubs, either South Africa, Ghana, Abidjan, Cote d'Ivoire, Kenya, Ethiopia, most of these countries, even Senegal, still maintained the taking temperatures at airport or sanitizers when you get to airports, as measures that came as a result of the Ebola epidemic. And this has helped in making sure that the interventions towards even COVID were useful. But then there's also the challenge about, the high speculation of exactly how this disease is transmitted. What is this mode of transmission? And that's how, even globally, we missed some of the earlier milestones in being able to know when to even lock down, when to close our borders, among others. But as time goes on, we're able to draw not just on the lessons of Ebola, but also on the resource mobilization techniques that were used. Being able to use test codes to be able to get people to text money and contribute $1 or $2 towards a fund that could be used to get the kind of resources that these countries need, or countries that have no support, and getting the kind of information necessary to plan. So I think there were some lessons that we got out of the Ebola response, but more than anything else, what it's done is strengthen the partnership of getting the private sector to be able to work with the African Union. The African Union, the public sector has a tendency of seeing the private sector as people who are just interested in profits. Private sector sees institutions like the African Union as being a bastion of, if you like, a bureaucracy.
Yes, because I'm very keen and particular about how the private sector and the African Union are going to be working together, and what formats and templates are you putting together, especially with regards to raising finance, because I understand that the private sector can be very instrumental in that regard.
Indeed. And also, amazed at how, like I was saying earlier, that we've seen private sector looking at governments as being bureaucratic, governments looking at private sector as just being profit-oriented. But it is during the moments of epidemics like this that you see people come out of, bring out their best, and put profits aside and look at how do we help work together. So some of the mechanics, we found the AU and the public sector being very willing to learn about the very innovative ways of raising money, making sure that they bypass a lot of the bureaucratic processes and the procedures in making sure, but while still maintaining the transparency and the accountability process in being able to account for, mobilize resources and account for them. But also just the whole nimble nature in which private sector is able to go around sourcing things and products and making contributions. But also, we also learned a lot, we in the private sector learning a lot from the public sector in terms of the interplay of making sure that you have various institutions and stakeholders on board, because of the kind of convening power that the African Union has in being able to bring not just the leaders of our continent, but also the advocates, people in advocacy, people in media, among others, to be able to centralize around one common effort or fight against an epidemic as besetting and as what we ourselves now, which is COVID-19.
All right, but very quickly, I would also like you to speak about the importance of this committee post-COVID, very quickly, because we're fast running out of time.
I think the committee amorphously came together because we saw a need and we volunteered and we came together using the relationship that Afro Champions has with the African Union, to work with the AU. We'll still continue to work with the AU on the trade response, which we've been doing prior to COVID, mainly the Continental Free Trade Area. But in terms of the COVID and CDC, as you know, CDC was formed after the Ebola epidemic, and some of us within the private sector were very instrumental in the campaign for that, and we saw the wisdom in our leaders establishing a Center for Disease and Control. Because we also foresaw that there's going to be more and more epidemics of this nature, and the continent needs to be prepared. So the committees, there are some people in the committee who are moving on to the board of the fund. There are others who will be working with the Joint Secretariat with CDC to give support. There are others who will continue to provide support virtually as and when needed, and others joining the PACT campaign, which is the campaign to help people track, trace, and get people tested for this disease. The only objective for this committee coming together was to ensure that we put all hands on deck fighting this epidemic. And once this epidemic is over, there'll be no use for this committee. But what we would like to see is a more strengthened Center for Disease Control and the capacity to fight diseases of this nature. Thank you.
All right, then thank you so much for your time on the show. Definitely quite interesting, and I definitely hope that the mandate of the committee is achieved. Because seeing that you're trying to, structure an emergency fund, you're also trying to deploy awareness and raise a campaign around the fund to mobilize African private sector and international donors, and also support the CDC's communication efforts about its activities against COVID-19. Thank you so much for joining me on the show today. I've been speaking to Edem Adzogenu, who is the chair of the AU CDC and Private Sector Resource Mobilization Task Force. He's also the co-chair of the Afro Champions Executive Committee. And that's it on Beyond Markets for today. And thank you so much for being a part of the show. Thank you so much for being a part of the show. You can watch the show at 5 p.m. West Africa time daily, and have access to all previous episodes of Beyond Markets on our website. That's at cnbcafrica.com. For me and the rest of the team, have a wonderful day.